Greetings of the day to all. This is Dr. Vineeta, and today I want to discuss with you all a very wonderful remedy, and that is Kali Sulph. We all know that Dr. Sussler has wonderfully described this remedy in his work in the biochemic form. As we all know that biochemic works on a principle of disequilibrium of any salt inside the body, and to make the salt visible inside the body, the equilibrium should be maintained by giving some biochemic remedies. So Kali Sulphuricum has already proved in biochemic form by Dr. Sussler. But again in homeopathy, many of the pioneers of homeopath or consulting homeopath have proved it extensively time and again. And when they got a set of symptoms, that these are the set of symptoms which are in Kali Sulph proving, then what they get that it is quite resembling with the pulsatilla. So another term that is used for Kali Sulph you will see in many books of Materia Medica is that Kali Sulph is the chronic of pulsatilla. Now, major portion of Kali Sulph on human body, the main particulars of Kali Sulph on human body is skin. It is acting on skin wonderfully. It is acting on mucous membrane wonderfully, and it is acting on the respiratory system of human body wonderfully. Now, these three particulars are the main particulars of Kali Sulph. Now, coming to pulsatilla and this Kali Sulph. Now, pulsatilla and Kali Sulph are all together same except one thing, that is a skin symptom, which I will get into later in this video. Now, coming back to the mucous membrane, we all know that mucous membrane, whenever there is any bacterial infection, then the sputum or the expectoration will become yellow because of that bacterial infections or inflammation inside the respiratory passage. So if there is any kind of discharges that is yellow, that is bacterial infection, that is very tenacious, that is not thrown out of the respiratory system, then Kali Sulph is the medicine for that. Now, it is acting on respiratory and mucous membrane in both ways, producing excessive mucus whose color will be of that yellow. Now, coming to skin, we know that it is chronic of pulsatilla, but skin symptoms of both the remedies are very different. In pulsatilla, we see that there is a redness, more kind of very much inflammatory kind of conditions which is present in pulsatilla. But on the other hand, contrary, there is a word that is used in Materia Medica, that is desquamation of skin. The desquamation of skin you will see in diseases like psoriasis, in diseases like eczema, in some of the diseases in which the skin is peeling off from the surface itself. So that peeling off sensation or that desquamation sensation is very sensitive and very common in Kali Sulph, which is apart from that thing also. Now, coming back to the discharges are yellow because of bacterial infection. As we already know that Kali bitch is having discharges that is green. Now, this pulsatilla is same in mental wise also and physical wise also, except the skin symptoms, that is very far apart. Now, we all know that arsenic album is a remedy that we can give to a patient who is suffering from so and so complaint, and if after giving arsenic album the patient is not cured fully and few of the symptoms are left, then the chronic of arsenic album is Kali Ars. So, as pulsatilla's chronic is Kali Sulph, arsenic album chronic is Kali Ars. Now, talking about the very peculiar symptom of arthritis of Kali Ars, it is similar to that of arsenic album. And when talking about the arthritis of or joint pain of Kali Sulph, it is a kind of joint pain which is wandering in nature, and the same similar symptom is present in pulsatilla itself also. And the peculiarity of this symptom is this: moreover, in common, when we are having any kind of joint pain or any kind of certain pain, then it will be get ameliorated whenever there is application of some warm thing, hot application, something like that. But on contrary of this, in opposition of this, Kali Sulph patient is getting relieved whenever the person is in open air, the person is in exposure to some cold things, and the condition get worse when the patient is in warm room or hot application or in hot environment. So this is something that is very very characteristic about the Kali Sulph, or you can say the pulsatilla also. So all in all, briefing about this remedy, that is Kali Sulph, it is a biochemic remedy, also used homeopathically as proved by many pioneers. It is acting mostly on mucous membrane, skin and respiratory system. It is called the chronic of pulsatilla. It is having same arthritic symptom as that of pulsatilla, same mental symptom as that of pulsatilla, and same other symptom except the skin symptoms that is very different in both the remedies. Skin symptoms of pulsatilla are different from skin symptoms of Kali Sulph. Now, this remedy, we can also use this remedy very frequently whenever there is a patient who is having excessive dandruff, and you will get to see that the dandruff is having that type of scab which is very yellowish in nature. Okay, so by seeing the type of dandruff, you can prescribe Kali Sulph to the patient, and you can also prescribe Kali Sulph to the patient internally as well as applying it externally. Tell that patient that you should crush the 4 to 5 tablets at a time and mix it with some coconut oil or some of the rose water or any other external things, and just apply it at the areas in which there is dandruff present. So it will definitely continuous and repeated use of this remedy in that form also will reduce the dandruff for a particular person who is suffering from dandruff which is very itchy, in which there is desquamation of skin, that I have already told you before. Desquamation of skin, the skin peels off, the scab is yellow in nature, so you can use in that also. Talking about the potency, you will definitely start with 30 potency whenever you are seeing very characteristic symptom or very relevant symptom to in patient of Kali Sulph, and whenever there is any kind of improvement seen in patient, then you need to understand this, that the totality, after taking the totality, if there is any kind of improvement, then you have to change or you have to reduce the repetition of any medicine. Otherwise there will be, it is of no use to prescribe someone some medicine. So this is all about Kali Sulph. Thank you.